appreciate everyone taking the time to be here with us on this nice summer-ish type of day. And I want to recognize a few people first as we get started. So I want to recognize Mr. Chris Cotter, one of our school committee members. Also, we have several other members of our staff who've been instrumental in helping us get to this point today. So we have our Assistant Superintendent for Facilities and Operations, Andrew O'Leary, our Deputy Superintendent, Karen Tredup, and also Jen Ferlin, who oversees lots of special projects and those type of things. Also, we're here at Gomes Elementary, and I want to recognize the principal, Ms. Ellen Gallant, who has had students who are in the building right now and has been doing a great job with them throughout. Shortly, I'll also introduce the Honorable Mayor, John Mitchell, who will have a few words for us as well. So what I wanted to do first is share what we've been doing over the last several months and then lead into where we are right now and how we got into the position that we're in. So over these last few months, we explained that we wanted to ensure that we were working to ensure equity for all of our students. We want to make sure that the priorities about health and safety remain the same. That balance, we've been working tremendously throughout the year. We want to make sure that we recognize our parents who've entrusted us with their children during this time, all of our principals and their teams for being able to work out the logistics and getting school open at the beginning of the year, the building service staffs for taking care of everything, getting the buildings assessed in the beginning of the year for ventilation systems. See, the wind is also with that, with the building processes and the ventilation air exchange units that we've had in our buildings. We have about 800 of them. There was a rush to get that done with an assessment of all the buildings during the summer to ensure that they were ready for students and staff to be there. And definitely for our nurses for being able to manage this situation. And nothing can be done without our teachers and our paraeducators, our counselors, our cafeteria workers to be creative and making and keeping learning alive at all times. So again, just touching on a couple things in terms of, we've been able to have about 9,000 students in classes since October. So we started in September in our technically phase 2. We had phase 1, which started in August, where we had our staff come in and we worked with them to get everyone acclimated to the new ideas and thoughts, and did some professional development on how we're going to do student engagement virtually and making sure that they receive support that they had. One thing we have to recognize, and I say we had about 9,000 students, close to 2,000 of our students, so about 1 in 5 as we started the year, had internet challenges, so meaning they had unreliable internet access. We did a lot of work throughout the year with the school committee, with the mayor's office, with our teams to reach out, get support from some of our partners to make a huge dent in that. So we know that there's still some struggles in as we're working through it now, but that number is drastically different. We've been able to provide hotspots for our students during this time to ensure, when we think about equity, to make it a more equitable situation. Also, with the hybrid process, we want to ensure that everyone knows that, a little over 5,000 or more than 41% of our families are challenged with some communication barriers. So those are other areas that we dove into more with our wraparound services, making sure that we're translating more information, ensuring that, I appreciate cable access being here today and throughout the year. We've done cable access videos to ensure that our parents were receiving information that was timely and a lot of our information being translated. A couple other things. So again, the history of the implementation process. So in July, we started planning. We got an outside company to assess all of our buildings, checked all of our airflow exchanges, windows, doors, anything that we thought of that we needed to look into to ensure that the buildings were going to have proper airflow. Leading us into August, like I said, it was our phase 1 working with our staff. We had plexiglass added, clarified the expectations about mask wearing, keeping to the 6-foot distancing at all times. We had parent meetings during that summer to ensure that parents were more comfortable about what we were planning to do. We had videos created in our almost like virtual tours of some of our schools to pull people in to be able to see exactly what was going on. So as we got into September 16th, which was phase 2, we had our cohort A students in-persons 5 days a week. So those were our students who had the most amount of needs and some other specialized situations that we had some flexibility with our principals, where they were able to pull as many of those students into class as they could. October 5th and the 19th started our phase 3, and we also created which added cohorts B and C, where those students were in classes Monday and Tuesday and Thursday and Friday. So that's where we had about 9,000 students. So to today, that's how we've been able to work through that hybrid. Also with that, during that time, so since October, we've been the largest school system in the state of Massachusetts with the most amount of students in school. Now others have added to it, which is great, because we work together. We have a lot of talk in terms of how we can connect and collaborate with other districts to make sure that we're taking care of all students. But definitely in New Bedford, with our 9,000 students, our total 13,000 population, we've had more students in person throughout this time. Now, as we lead to calling this, our next step, looking at March 4th, and seeing, we've also had more parent meetings again to allow parents to know exactly where we are, how things have gone over the last few months, to ensure that we've been able to answer their questions, always making sure that we're leaning on the side of safety. We know that the positivity rate had increased, but as I stand here today, and I'm sure the mayor will speak to that as well, the positivity rate is down to 5.4%, which means that it has decreased over the last several weeks. I believe over the last 6 or more weeks that we have seen a decrease with that. So with there being no transmission in our schools at any time, now is a very appropriate time to, we'd already been planning for months what it was going to look like in March as we got into April to get our students back. Now that we see that the transmission rates in the city have gone down, and they've gone down in lots of other places as well, I think it's an easier thing for everyone to be able to understand that the schools are, I don't want to use the word safe, but they are safe. We're safely reopening, but they've always been safe. And with the mitigation strategies and with our staff, they put forth a tremendous effort to ensure that we've been able to meet all of those objectives. And let's touch on a couple more things, and I'm going to ask Mayor Mitchell to come up. So other areas that we have really been adamant about in terms of contact tracing. So of course, we've had the most amount of students in school. So that would say that we've had the most amount of students who would have tested positive throughout. So when the numbers are reported and people will say, well, New Bedford has the highest number of students. Well, New Bedford has the highest number of students who've been in class, so therefore we will have the highest number. And again, but there have been no cases that have been transmitted within our buildings. So when we think of that, again, the schools are safe. We have, on average in terms of attendance right now, we have about 91% of our students are attending virtually or in person. We would like that to be 100% on any given year. It's slightly higher, but it's one of those things that we continue to work through as a school system. So COVID has impacted that, but we know that with the work that our staff has been doing, they've definitely been able to make a dent in keeping those students engaged. It also goes along with our performance data in terms of students being engaged. If they're not engaged, they're not going to be able to do well on any of the assignments that we're assigning them. And even today, I was able to view several classrooms because we do these learning walks where we break it up where some people are in person, some are virtual, so we're able to tap into it and we can see. So I saw about 12 different classrooms today in addition to the others. I saw other rooms, and we can see that level of engagement from kindergartners to first graders to fourth graders talking about fractions. So there's a lot of work that is being done during this time. And with our teachers, as we ended in the spring, when they created these video lessons, and again, I put appreciating cable access for all their support and being able to record that, making them available for our students during that time. Another area which I know, and then there'll be some questions, vaccination process. We don't control the vaccination phases that exist. However, we do have a little bit more than half of our staff have already volunteered. So we're still putting the information out, sharing. We don't know where we are in terms of how long that will take. We just know we're in phase 2. That's not something that we're able to control as the school system. Along with that, I know I skipped a little bit in terms of contact tracing. When I said before, we're adamant about it. We follow the CDC guidance as far as what a close contact is. We have had some classrooms that we've had to close throughout this time, but it was never because of a spread. It ended up being because of the number of close contacts that were possible. We were down staff. And so we have to remember that our staff again, I'm going to keep saying they do a great job, but we're all people. All of the same challenges that we have as individuals in a normal time, we still have them now. So individuals get sick or there's family illness and those type of things completely outside of COVID, those still impact how our staff and what we need to do to be able to have people in. So the last piece is we're here today because on Monday we're planning. We've been talking about this for several months, and a few of our schools, including where we are today at Gomes with Ms. Gallant, were actually ready and petitioning where they were ready to come back with an expansion of their cohort A this past Monday. But I told them to hold on so we can make sure that there's some other logistics we needed to make sure that we worked out in terms of transportation, food services, a lot of these areas that we hadn't touched on as much over the last few months just because of the timing. So with that, we will have about 7 schools that will open, that have been prepared to expand their cohort A for this coming Monday. And the priority for that has been with our earliest grade, so with kindergarten and first grade. However, schools are configured much differently in terms of the classroom sizes, the materials that they have in there, which will impact the number of students that can be in the classroom at the same time. So, for example, what it is cohorts B and C are being combined. So if there were 7 students coming on Monday and Tuesday and another 6 on Thursday and Friday, we can do the math. That's a good enough number where we can keep them at 6 feet apart. We increased the plexiglass that we've had in there and some of the other barriers that are there. And what I've asked people to do is not compare schools because they are different sizes. And although I said we're going to focus on kindergarten and first grade initially, some schools are going to be able to add some of their higher grades because we're only focusing on elementary right now. They'll be able to add some of their higher grades at the same time. So I'm going to make sure that we're understanding that. So again, kindergarten, first grade is our priority. But if a school can add third grade, then that's who they'll be able to add this coming Monday. So you have about 7 schools, like I said, and I can quickly name them. But we'll have all this in writing, and we're starting off. Apologize for the. So starting off with Kearney Elementary, Gomes Elementary, Haymack, Renaissance, Rodman, Taylor, and Winslow. I believe I didn't leave anyone out. And so with that, and I know people will be wondering, well, what will be the next step, the next phase with that? We know that there are several other schools that are ready for March 8th. And I'm not going to quote it right now, but we believe that the majority of the elementaries will be able to open, they'll be able to expand those grade levels on March 8th. And then there are several others. We believe that by the end of the month, we may have been able to increase the cohort A, and then probably will no longer call it cohort A. We'll probably be able to increase that where all schools will be able to accommodate the majority of their elementary students. So again, we're talking about students in grades K through 5. So with that, I'm going to turn it over to Mayor Mitchell, and then I'll be able to answer some questions.
All right, well done. All right. It is chilly. I think we're deluding ourselves to think that it's summertime, but all of us who aren't wearing coats. So I want to just begin by with a word of thanks to the superintendent and his team for all the work they've done over the course of the school year. It bears repeating. You've heard it from me before, but the work done in this school district over the last 11 months now, almost 12 months now, has been extraordinary, ranging from the superintendent and the central office staff to the school administrations at each building, including here at Gomes with Ellen Gallant and her team, all the faculty, all the staff, the custodians, everybody has really, school bus drivers, everybody has really stepped up in every respect to take care of kids, to make sure they're safe, to make sure their colleagues are safe. I know Chris Cotter, a colleague from the school committee, feels exactly the same way. There's been, despite the challenge of the pandemic, people are really motivated to get kids through, to take care of our kids. And so really, to my mind, bears our expression of gratitude bears emphasizing. It's been extraordinary. Throughout the pandemic, our goal has been this: to do what is necessary to preserve and advance the best interests of our residents, period. Sometimes we here have done things that are decidedly different from other cities and from the state, both more strict and more liberal, and it depends on circumstances. So we look at things like right from the start of the pandemic, we canceled the New Bedford Half Marathon right out of the gate before there was a positive test, a single positive case in the city. We and this has gotten a lot of national attention. We have put in place a regime for factories and fish processing plants that has literally saved lives and staved off the fate that a lot of meatpacking plants in the Midwest had to endure. We were the first city in the United States, and I think still the only one, that offered a free mask to every resident that wanted one through a partnership with Joseph Abood. So we've been able to spread masks around the city. We've been really strict around nursing home visitation. We put in place restrictions there that we thought were very necessary to protect the most vulnerable in our city. And we've done things like we've been very consistent in our enforcement of regulations of restaurants and bars and other venues, so that again we don't have outbreaks and it's worked. But there are occasions where, frankly, we need to do less, or not do less, but not clamp down, not be as restrictive, and that's come here in our schools. New Bedford, of the 10 largest school districts in the state, New Bedford's been the only one that has been hybrid from the start. We took extra time off around the holidays because we're running short of substitute teachers, as a lot of you experienced, but the policy has been hybrid. And that is because it is abundantly clear to us that kids suffer both educationally, as well as socially, as well as psychologically and emotionally from being isolated at home staring on screens. And it's been well documented. There have been a number of really authoritative reports done by a number of think tanks. By McKinsey did one recently. One study from Stanford University found that in the roughly 183-day school year, kids who are entirely remote effectively lose 57 of those days, roughly a third of the school year, just by being remote, in terms of just the quantity and quality of the information that they absorb over the course of the school year. We don't want that to happen to our children in New Bedford. We believe they deserve our best, and they deserve, as do all of our residents, for us to make decisions based on data, based on the input of health experts, and based on our knowledge of the city. And so the announcement today is a very significant one. Again, of school districts nearly this size, nobody else is doing this. That is to say, bringing back full-time our elementary schools. But that's what the announcement is today. We believe it is safe to do that. Cases in New Bedford have come down considerably over the last 6 weeks. On January 4th, we had our highest day. On January 4th, the city had 263 new cases. Today, we had 15. Over the last 5 days, we've averaged 18. So things are considerably different right now. The vaccination process isn't going as fast as we'd like, but it is picking up. The 3 major manufacturers of vaccine in this country announced last week that they will be delivering some 240 million vaccines to cities like ours all across the United States by the end of March. So that's happening right now. We believe that our schools, as the superintendent has pointed out, are safe, have been safe all along, and I think that the drop in cases that we've seen recently only reinforces that. We have seen, despite our being hybrid the entire school year, we have seen no evidence of disease transmission in any of our classrooms. And so, to my mind, our approach is not to give into hysteria. It's not to be casual as well when it comes to COVID, a deadly disease. It's to get the best information possible and make the best decisions for our residents, and that's what this is about today. So I want to thank again the superintendent for his leadership. This is a decision that the school committee fully supports. It's something that he has been discussing with us for a number of weeks now and has worked carefully through the process, has been very deliberate in his approach and speaking to administrators and to teachers and to other staff to ensure that we're doing it the right way. And we're fully confident that it will work for the benefit of the children of our city. So with that, I'll close and we'll go ahead and open it up for questions.
Back down so I can move it back down. Are there any there is one thing I definitely wanted to make sure I added. When we say that we're expanding, I wanted to remind everyone that cohort D, which is fully distanced at this time, will remain fully distant. So we're going to leave that. We're going to leave that where it is right now, and then over time, once we've gotten everyone else situated and parents are still interested in making that transition from fully distant to being back in person, then we'll be able to have that conversation then. Also, since there are no questions, I just wanted to make sure, expressing some more thanks. Part of the reason why we've been able to be in a very good position now is because of the conversations and the collaboration we had with our with Fred Pearson and Chris Garcia when he was the head of the teachers union and the unit A and B. So that is a large part of being able to help us have the right discussions, put us here, have everyone being of like mind, understanding how it impacts staff, how it impacts the families and our students. I definitely wanted to take a minute to mention that as well. Good.
All right.
Thank you very much. I appreciate it.
No questions, nothing. We answered everything. All right. Thank you, everybody. Thank you.